Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our course on medication safety course. In this session, we will discuss types and causes of medication errors. We will start with omission. Learning outcomes identify the most common types and causes of medication errors that occur in acute care setting. Describe why medication errors occur. Understand ways in which you can help to prevent medication error from occurring in your workplace. What are the most common types of medication incidents in hospital? You can select from omission, dose error, wrong patient, wrong route, wrong time, wrong drug. Omission is the commonest cause of medication error. Case study, Ali is a 36-year-old male. He has corneal transplant 20 years ago for inherited corneal abnormality. Admitted to the hospital with confusion, fever, diagnosed with severe malaria requiring 6 days of ICU care. He was in shock, moderate ARDS, and acute kidney injury. On the 5th day, he started to improve and recognized that he was not given his anti-rejection medication used for his corneal transplant. Here, this patient missed his medication because of incomplete or inaccurate history. Full drug history, including home medication, over-the-counter medication from the most reliable source should be taken. Case study number 2, this is an 84-year-old female admitted with heart failure and pneumonia. She received antibiotic for her pneumonia and appropriate treatment for heart failure. And on day 4, she developed left leg swelling and that followed by sudden shortness of breath. Most likely, this lady developed DVT and probably has pulmonary embolism. So lack of knowledge or awareness about the best practice guideline or overlooking guideline in practice. This patient is at risk of DVT. If screening and scoring was done, we would have recognized that she need to be on prophylactic anticoagulant. So this is an omission error. This can lead to severe consequences, including death. Case study number 3, Ali is on lifelong treatment for atrial fibrillation. He is on anticoagulant. He was admitted because of severe sepsis on antibiotic levofloxacin, and his INR was high, and this is why his coumadin was on hold. On discharge, this was missed. This is a transcription error. It is easy to omit medication when transcribing from one source to another. Errors can occur when writing up new medication chart or when preparing discharge script. And this can be overcome by utilizing medication reconciliation, and we will have a discussion about medication reconciliation in another session. When administering medication, it's important to check each patient medication chart thoroughly. A number of factors can contribute to oversight, omission, interruption, distraction contribute to 25% of administration error, stress, high workload, fatigue, inadequate staffing level, poor light, and noise. Omission due to incomplete or inaccurate history, this is one of the cause. Also, lack of knowledge of best practice guideline and transcription error and oversight. These are some causes of omission error. A new order, this is a case that a doctor write a new order is prescribed and when a new order is prescribed, it's essential that the nurse be made aware verbally so that the drug can be given as intended. So this is reflects the importance of communication between different healthcare provider, especially when the drug is needed immediately. It is better you communicate to the nurse so that the drug can be given on the correct and right time. Sometimes you cannot administer the drug. Both the issue of not administering the medication and the reason behind that should be explored, documented, and communicated. Medication team must be aware verbally so that medication regimen can be altered if necessary. For example, sometimes patient is absent or on leave. He is out of the floor for study, radiology, or going for consultation in another department. Here, when we communicate that, we can plan if the medication can be given before or after that absence of leave. Sometimes the patient cannot take the medication because he's vomiting or because he's fasting for a study or a surgery. And here, when we communicate this to the care provider, we can give an alternative route by IV or to see if it's appropriate to hold the medication. If the patient refuses, then you notify the doctor. Communication need to be done to figure out what is the reason for refusal. If the medication is not available in your formulary, in your supply, then we need to make a plan to get it from somewhere else or change to an alternative medication. If it is withheld by a doctor, this need to be reassessed. If for a temporary reason, then we need to know when we should go back to the medication. If the medication is self-administered by the medication, nurse should make sure that the patient took it on the right time in the right way, and this should be also documented. If a medication is unavailable, the nurse should contact the prescriber and the medical team, including pharmacists, and they should look for an alternative solution. So take-home medication omission. Medication omission are common common. It could be due to many factors: incomplete or inaccurate history, lack of knowledge or lack of awareness of best practice guideline, and transcription error, oversight, poor communication with the staff, and when medication is not in the stock or not given for different reasons. Thank you. See you in the next session.